Our next speaker is Dr. Erkut Borazanci, the Deputy Director of Oncology at Honor Health Research Institute and the Clinical Associate Professor of TGen's Clinical Translational Research Division. Now, Dr. B is an elite expert in the field and treats many of the patients who are here with us tonight. Dr. B is currently working with Dr. Susan Tsai on the pancreas clinical trial, which is funded by the Sina Magowitz Foundation and currently underway at the Medical College of Wisconsin's Le Bon Pancreatic Cancer Program that Roger spoke about. This trial relies on next-generation sequencing to help determine a patient's specific tumor subtype, and it's already garnering great reviews from the National Cancer Institute, the nation's leading authority on cancer care and information. He is also writing the manuscript for the TGen Triple, a clinical trial that set new standards and guidelines in a pancreatic cancer treatment and care. Dr. B, would you please join us on the stage?
Good evening, everyone. And I just want to express my gratitude to Roger and the Sina Magowitz Foundation for the opportunity to talk tonight. And again, to see you all out here this morning and this evening to support this wonderful foundation as we strive to do better for people with pancreas cancer. So I do want to spend some time to talk about the progress, thanks to you all, as far as what we've done with pancreas cancer very recently. This trial is a phase 2 trial that combines immune therapy with the antibody nivolumab with that TGen triple, that gemcitabine, nab-paclitaxel, and cisplatin, with the medication paracalcitol, which focuses on the vitamin D receptor and activating vitamin D. This was built upon work by our colleagues at the Salk Institute from prior collaboration. So the science was very, very solid. And what they showed in the lab was that by targeting vitamin D would allow changes in the immune environment in pancreas cancer. As mentioned just now, we are pending publication of this work that was supported by you all from this foundation here tonight. I do want to share with you a waterfall plot of the response with people with stage 4 pancreas cancer. These are all individuals that, except for one individual who had shrinkage of their cancer compared to the baseline in a very difficult to treat population. So we're excited about these results and sharing this throughout the whole world and building upon what can we do better in this for these patients. Some of these results, too, led to remarkable findings in the scans. On the left side is a CAT scan of one individual, and on the CAT scan shows a picture of their liver. There's multiple dark spots, which is indicative of disease, along with their initial PET scan. And you don't want to see your PET scan light up in your liver with pancreas cancer. So that's all disease in the liver initially. After a few months of therapy, you can no longer see that active disease in the PET scan. And on the CAT scan, the liver appears to be all but resolved of disease itself. Additionally, on the right side is a case of an individual who has disease in their abdomen or the peritoneum, which is typically associated with a very poor survival outcome in stage 4 pancreas cancer. And that individual's disease appeared to resolve after a few months of therapy. So we're proud of the work, and we're publishing it in the coming weeks ahead, and we're also doing a lot of additional analysis with our colleagues around the country and around the world. So please stay tuned, but thank you. As mentioned before, we're very grateful for the foundation's support of the Sina Magowitz Foundation in funding greater research and collaboration together. This is work that's done, that's based upon Dr. Ye's lab. Dr. Zhenjian Ye is here tonight, and what her work is looking at is classifying pancreas cancer tumors by either a basal or classical type. And by allowing us for more personalized therapy based upon their profile. This work can be done and analyzed just by a biopsy at initial diagnosis with pancreas cancer. And this is work that's being led here by Dr. Tsai and Dr. Evans at MCW that we're also working together with at Honor Health in Scottsdale, Arizona. And our team is working hard in collaboration to get this analyzed, and so we can, again, do more for people with localized pancreas cancer to bring that combination therapy that seems to be so effective in people with advanced disease earlier in the disease setting, so we can have those great long-term outcomes, those years of survival. What's also important is building upon the science to make all therapy work better for so many. We still find individuals with advanced pancreas cancer resistant to the immune system. So many of you have heard of individuals who have had drugs like Keytruda that allowed their immune system to attack cancers such as lung cancer and melanoma so effectively. We're still working behind the scenes on trying to make the immune system more active against pancreas cancer. One of those leads that we have understood in the lab targets transcription factor 2H, or TF2H. And by targeting it, it actually affects the tumor microenvironment in pancreas cancer cells to be more sensitive to immune therapy. We call that revoking the immune privilege. And work that's done by my colleague at TGen, Dr. Hyan Khan, has shown that by targeting TF2H in pancreas cancer cells, we actually can improve upon the response in a significant way with novel immune therapy antibodies. So we're very excited about the possibility of bringing this work to people with advanced pancreas cancer and utilizing these more exciting novel antibodies against pancreas cancer with immune therapy. We do know, though, pancreas cancer can be cured at earlier stage, just like so many other cancers, such as breast cancer and colorectal cancer. We don't have that mammogram or colonoscopy yet for pancreas cancer, but we know if we can find it earlier, people have a great chance of living longer. This actually is data that was published 3 years ago, but that's really old data. This is from 10 years ago of survival, that if you have stage 1 disease, earlier stage disease, your chance of living is very, very high with pancreas cancer. So there is a lot of hope. The goal is to bring those effective regimens earlier into the disease setting and being able to identify people that may have pancreas cancer earlier. And to that end, there's a lot of work that's being done around the country, around the world, to catch pancreas cancer early. The key thing is trying to identify who could be at risk, and the centers that are developing to identify those and take care of those people at risk. Those are people that have a history of pancreatitis, have a family history of pancreatic cancer, who have genetic mutations that lead to an increased risk of pancreas cancer, and those that may have precursor lesions, and being able to identify them by novel blood tests and imaging techniques so we can avoid the diagnosis of stage 3 and stage 4 disease and catch it earlier and intercept that cancer from coming. We're very fortunate at Honor Health to be able to offer a high-risk program. We've looked at a couple hundred individuals at high risk. My colleagues, that some of them are here tonight, including Gail Jameson, works closely with all the other doctors, with our team, to develop ways to catch pancreas cancer earlier. We have found a handful of individuals within our program with pancreas cancer, most at an early stage disease where we can offer them a cure. But more needs to be done. And some of that work is based upon great science that's emerging to be able to discover, using blood tests to capture things such as exosomes and microRNA that's in our blood that we can see before it actually shows up as pancreas cancer. There's a lot of work that's out there involving other tests that doctors can now order, including Gallery. There's also work being done in the research setting with tests such as Immunova and Freenome. And there's a lot of collaborative efforts to do more for people with pancreas cancer. So detection is really, really the key. And the future is going to be interception. It's going to be able to identify and be able to intervene and to prevent the cancer from actually showing up as pancreas cancer. I want to thank you all again tonight for coming out, for giving your support for all these years, for what we all do. I also want to recognize our team that meets every week, all these different doctors, all these different nurses, nurse practitioners that get together to talk about cases from a variety of specialties, GI doctors, radiologists, radiation oncologists, surgeons that get together locally, but also we collaborate so often around the country, around the world, to share this information, share the data so we can do more. But without your support over the years, we cannot see what we're seeing. And so I want to thank you all, not only for your support, but also giving me the chance to talk about this tonight. So thank you.